It was around noon when I got a phone call from Adam's school, and they said Adam fell, and we had to call the paramedics. I said, the paramedics, is he okay? And they said, I think you should come.
Well, that day was basically a normal other day. We had lunch and then we went out to play, we were talking and everything, and all of a sudden Adam falls forward. And we thought it was a joke because it was April Fool's. And we thought he was gonna put his hands out, but he never did. And then he fell onto the concrete. And then Joshua went to him and then saw blood. And then I ran to go get help.
I had a lot of different things going through my head, so I was scared. It was the longest drive I've ever had.
I could hear a neonate on the walkie saying, we need an ambulance, we need an ambulance. A student's hurt and there's blood.
His body was very limp, and we knew that it was more than him just falling and hitting himself.
You don't think that, it's so dramatic that his heart is gonna stop on campus. Like, that doesn't happen. Like, when does that happen?
It just seemed like an eternity from us saying we need help, and then hearing the firemen's sirens approaching.
I have my drug box and my monitor going towards him, and there's just a sheer look of panic on the teachers that are there.
And at that point, noticing that Adam's breaths had stopped, and we started shouting, please, please, he just stopped breathing.
When we first arrived on scene, we found Adam lifeless. He was clinically dead. He has no heart rate whatsoever, and he isn't breathing.
My partner Joe got on chest compressions right away. We got the IV established. We put the pads on him, shocked his heart, and then within about 3 minutes of that, there was a beautiful agonal breath that Adam gasped.
And the feeling that I felt, that chest rising underneath my right hand, was the most amazing feeling. That same feeling of watching your kids born, that's the same feeling I had when Adam took that deep breath.
They called me and told me the paramedics are taking him to Queen of the Valley. And I said, why? They wouldn't tell me anything. They just said, just go straight to the hospital.
I was the emergency doc on duty, and I heard from the nurse that this 11-year-old boy was coming in. He had been unresponsive. He had stopped breathing, didn't have a pulse. When I heard that, my first thought was, oh no, this is not good.
When we first arrived at Queen of the Valley, it was great because we have the doctors and nurses ready to receive Adam. They take him into the room and they continue to monitor him.
He got here and he had just resumed pulses upon arrival. So they got his heart beating again. His mom was there and his dad was there. And it's one of those emotional moments. I have kids, so it's hard. Those cases are really hard.
I was thinking the worst. I was thinking my son was gone. Was he gonna be? Was he gonna be with me? Was he gonna be okay? I had a lot of things running through my mind. Questions. Why? Why him?
We need a bigger ER. We have had a lot of good changes. Directors, we have more resources now. We don't have space.
Frequently, we don't have a room that's open. We have to wait for a room to open up. That causes delay in patient care. And the fact that we don't have enough beds for the patients or spaces for the patients takes longer for us to see them because there's nowhere to put people.
Sometimes I'm nervous and worry about when my family calls 911, or if you call 911, we're going to be unable to necessarily respond to you. There's been times where we've been at Queen of the Valley and we're hugging a wall. We're sitting there with the patient, still providing medical care, but we can't get them a bed. And so we're hearing calls on the radio go out that we cannot respond to. And most of the time those calls are more serious than the ones that we're with. And we have a stable patient, but we can't leave because there's no room for them.
That also contributes to the congestion in the hallways because we have our patients who are waiting for their results, patients who are waiting to be seen. So it gets a little tight.
So to have a new ER, a bigger ER, I feel it's a responsible thing to do for the community. I've been in this community for the past 14 years, and I've seen Emanate Health, Queen of the Valley, take care of their patients like you would your family, like you would your friends. And they are the community's hospital.
So for me personally, I would love to see the ER grow and be able to provide better services, more services to the community.
I can't even imagine what would have happened if my son would have not been treated, if he would have been turned away because the emergency room was too full. No, he wouldn't be here. Adam's doing great. Adam, he's fine, he's healthy. Doctors have, cleared him to play sports and to do pretty much anything that he wants to do. He's a healthy little boy now.
I'm thankful that the West Covina paramedics and fire department arrived when they did. And I'm grateful for the Queen of the Valley emergency department. They were able to get Adam the help that he needed to get better.
Luckily, we have a really good team here. We have really good doctors, really good nurses. And we all did our part to make sure that he was able to see his parents again.
No matter what, we won't forget that day, but we try to leave it behind us.
My family and I would really, really like to thank the whole staff, doctors and nurses, from the bottom of our heart. We're really grateful to them. Because if it wasn't for them, my son wouldn't be here.